Hello and welcome to another of the eBiology Teacher podcasts in our special series on the fetal pig dissection. Today is the circulatory system, and we're going to go over some components there. Now, for those of you who are hoping maybe for a little more substantial overview of all the arterial and venous structures, we're not going to get into that deep. This is really concentrating on the heart. So we're going to start with looking at the heart in anatomical reference, and then we're going to take it out of context and see if we can dissect the heart itself. We won't be getting into the specific arteries and veins and blah, 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 because we honestly don't have the time or the scope to do that. So let's take a look at our little fetal pig here. This is little fetus, for those of you who recall. And we can go ahead and review some of the anatomy that we covered in the respiratory system. This structure here that goes all the way down to the lungs is the trachea. This structure here is the voice box, the larynx. And of course we have some blood vessels, which we'll get to in a minute. These large lobed structures are of course the lungs. Now, as we mentioned in the in the respiratory dissection, the large conical heart-shaped muscle in the middle of the cavity is in fact the heart. Now, hopefully you've already gone over the anatomy, so all of this is going to be reviewed, but it's practical review because it's right here in the pig. First off, you have the right atrium. If you recall, the atria are not very muscular because all they have to do is take the blood from the body and push it down into the ventricle. The ventricle is the part of the heart that does most of the work in terms of moving blood. So that's going to be the more muscular part here. This obviously represents the right ventricle, and then the blood will go from the right ventricle through the pulmonary artery, which is the ventralmost blood vessel that we see on the heart, except for this large blood vessel that we see running down the center. That blood vessel is actually the coronary artery. Now, we may not have mentioned that in our lecture, but keep in mind that the heart is a muscle, right? So the heart needs blood just like any other muscle, and unfortunately the heart can't take in blood from the inside. So it has to have its own artery that gives it oxygen and nutrients to survive. So that is the coronary artery, and a lot of times people have heart attacks because their coronary artery is blocked, not because the aorta is blocked, not letting blood to the rest of the body. Heart attack is when the blood doesn't get to the heart itself. The muscle needs blood too. So, of course, if we leave the pulmonary artery, we're headed to the lungs because the blood in here has been used. It's got carbon dioxide in it, not oxygen. So it's got to go to the lungs, and they're going to go to the lungs through the pulmonary artery, and that's where they're going to pick up the oxygen that they need. All right. Now, if we lift the heart up, we can see these structures here leading to that main structure there. So you've got these branches that are kind of combining. They're merging into one. This structure here is the pulmonary vein, more specifically the right pulmonary vein, because yes, we have two lungs, which means we have to have a left pulmonary vein. Right? So we have a right pulmonary vein, left pulmonary vein, and they all enter the left atrium. And from the left atrium, they will go to the left ventricle. And from the left ventricle, they will leave the top of the heart through a structure called the aorta. And then what we notice here is the aorta branches into all kinds of different things, and the branches branch. And so we see all these blood vessels going to different places, because remember, the whole point of the heart is to push that blood to the parts of the body that need it. All right, so now that we have the external anatomy of the heart, there's one other thing we need to consider. If the aorta is taking blood to the rest of the body, what happens when that blood gets used up? Meaning the oxygen is taken out and carbon dioxide is put back in. Well, it's got to come back to the right side of the heart through either the inferior or superior, I'm in the way, vena cava. The inferior or superior vena cava. Now, what I'm going to do real quick is I've already dissected a heart out of the pig, kind of like Indiana Jones. Kalima, Kalima, right? So, I have to take that out in context. I'm going to look at the parts and see exactly what it does. So, let's take a look at the pig heart. Boop. There we go. Look at that. Look at that. Now, this is just as it appears in the chest cavity. All right. This is just as you would see it not dissected out. All right. So what I'm looking at here, just a real quick review, right atrium, right ventricle, left atrium, left ventricle, and of course that structure right there, the coronary artery. Let's take a little more closer view though at the blood vessels that supply the blood to the heart. Of course the coronary artery is what's supplying the actual muscle, but let's take a look at where the blood flows through the body. If we take a cranial view of the heart, meaning we're looking down on it, okay, this structure here is the superior vena cava or vena cava. Right, that's the main blood vessel that brings heart from basically the shoulders up. Okay, and of course there's an inferior vena cava which enters the dorsal part of the heart inferiorly. Now, the way we know that this is, and keep in mind right now you're looking at the heart from the back. The way we know that this is the inferior vena cava and the other one's the superior vena cava is both vena cava enter in the same chamber of the heart. Inferior, superior, that means my probe can run straight through and voila, we are in the right atrium. Okay, so inferior vena cava, superior vena cava, and then that enters the right atrium. Now, if we go from there, we go to the right ventricle. The right ventricle is going to send blood out, right? And the right ventricle is going to send it out the pulmonary artery, which is this structure here. Okay, this is headed to the lungs. The blood here has carbon dioxide, very little oxygen. It's got to go to the lungs, and it's going to come back through the pulmonary vein to the left atrium. All right, and then from the left atrium, it's going to go to the left ventricle. And from the left ventricle, it's going to leave the aorta, boom, to the rest of the body, and then come back to the inferior and superior vena cava, superior and inferior. Okay, so that's how that structure sort of works. I want to go over it one more time just so that we're clear, and I'm going to make a quick observation here for you. If you remember in a lecture earlier, we talked about the structure of veins versus the structure of arteries. Veins are going to be a flimsier, sort of light, not really holding their shape kind of blood vessel, not unlike the vena cava. See how flimsy they are when we look at them? Arteries, on the other hand, tend to be a little thicker, a little more muscular, kind of like the pulmonary artery and the aorta, both arteries. If we want to prove that point, if we look at the pulmonary vein, once again, we're talking about a relatively flimsy structure. So, let's go over it one more time, and then I'm going to take a look at the beef heart. Okay? Now, we have the blood coming from the body to the superior and inferior vena cava to the right atrium. From the right atrium, they go to the right ventricle. From the right ventricle, they go to the pulmonary artery. From the pulmonary artery, which once again is here, go to the lungs. They come back through the pulmonary vein, right? From the pulmonary vein, they go into the left atrium, to the left ventricle, and then out the aorta. All right? Now, we have to look at something bigger, right? We got a bigger is better and all that stuff. So let's take a look at a beef heart. This is a beef heart. I'm busy. I can't. Sorry, I got somebody knocking on my door. So I got a beef heart here, a cow heart. All right. If we take a look here, this is anatomical position. We're looking at the ventral side. Unfortunately, this specimen, the right atrium is sort of gone. Okay, but what we can see, and so we can't see the vena cava, but what we can see is directly into the ventricle there. We can definitely look right down into the right ventricle. Now, what I've done is done a coronal dissection, so I can actually flip this guy up, and we can take a look inside. All right, now, if we take a look in here, there's a lot of things going on. This large muscular structure opening here is, of course, the right ventricle. I want you to notice something too. Remember how we said that the right side of the heart is responsible for pushing blood to the lungs. Well, the lungs are right next door to the heart. So we don't need as much muscle on the right side of the heart as we do the left side of the heart, because the left side of the heart has to push blood all the way to the body and back. So obviously the left side of the heart is going to have more muscle. This large structure here in the center that separates the two ventricles is called the septum. Okay? But I want you to notice something else. Look at all this tissue in here. That's not just hanging out. Those have a purpose. These are valves of the heart, and they're one-way valves, because what happens is as blood comes down through the atrium, which is coming down here, these valves push out of the way, kind of like a turnstile in an amusement park. But when the ventricle contracts, blood, if we try to push upward, blood's not going to get through because it keeps pushing up, and the force of the blood actually closes the valve. The same is true if blood coming back in through one of the valves tries to get back into the heart. Okay, you'll notice here that if we push forward, that just kind of moves out of my way. But if I push back, if I try to push back on it, it closes and prevents backflow. So that's something important to take a look at. So this is, of course, the right ventricle. Now, the blood vessel is going to go out that way, right? So we're going to pump, right? So if I push my probe and I close the heart, my probe should be coming out of the pulmonary artery, because that's where the blood is flowing. And in fact, if you take a look, whoop, there it is. If we take a look at the top of the heart, this structure right here is in fact the pulmonary artery. Now this blood is destined for the lungs. It picks up oxygen, comes back to the left atrium through the pulmonary vein. Again, the atria are kind of hacked away a little bit here, but that's okay. All right, then it comes back in to the left atrium and of course finds itself in the left ventricle. From the left ventricle, that's going to contract and it's going to send blood out this vessel to the rest of the body. Now, where is that going? Well, wherever that probe comes out should be the aorta. And in fact, voila, the aorta. All right? And of course, it goes from the aorta to the rest of the body, back superior, inferior, vena cava to the right atrium. And there we go. There's the heart. If you want to put a little more perspective on it, let's take a look at the human heart. No, I don't actually have a human heart. Not that bad. Anyway, this is a pretty good model, though, I think you'll find. Now, this model shows us a couple of things. And of course, in our chest, our heart sits sort of like that, okay? Now, this would be the inferior vena cava. This would be the superior vena cava, which means this is the right atrium. Now, if we break my heart, all right, what we see here is we've got the right atrium. I know, I'm cheesy, I know, give me a break. Then we have the valve that goes into the right ventricle, and of course this vessel right here is, this valve right here is the pulmonary semilunar valve, and this is making sure blood doesn't flow back into the heart from the pulmonary artery. Okay, pulmonary artery. Now the question is, why is that blue? Remember, at this point, even though it's an artery, it doesn't have oxygen. It's got carbon dioxide rich blood in it. So all the blue vessels are actually representing vessels that are carrying blood that's carbon dioxide, not oxygen rich. All right, this is going to go to the lungs. All right, and then if we take a look at the dorsal side of the heart, kind of dorsolateral, we have the red structures of pulmonary veins. Yes, they're veins, and yes, they're red because they do have oxygen rich blood, and they're coming back, of course, to the left atrium, then to the left ventricle, and then up the aorta here to the rest of the body. And there we go. So before I wrap it up, why don't we look at the actual heart in respect to some diagrams that we see. All right. So I'm going to open up some diagrams. Again, this is sort of an overview kind of thing. If we look at our fetal pig with respect to the diagram, all right, I'm going to take a little liberties here. If we look at this, oops, sorry, I went away. Where did I go? If we look at the pig and we look at the diagram, there we go. We can see here clearly that we have the heart in the center, and we have all of the arterial artery structures and the vein structures. Again, I'm not really that concerned with us knowing all of those. there is one thing that we didn't point out, and that is this muscular structure down here at the bottom. That's the diaphragm. Okay, that closes off the thoracic cavity, which is this whole space right here. All right, but the main parts are the heart and the lungs, and we kind of get that. We can see the aorta leaving the heart, the pulmonary veins, and of course in the diagram, the lungs have been removed, so that's not something that we're really hyper concerned about. Now, if we want to look at the heart itself, I think the best structure to look at here probably going to be the human heart. All right, just because the pig heart is too small, but we'll put them kind of side by side here. All right, and actually, not a bad representation. This is relatively close to anatomically correct, depending on the age or whatever. So, if we look here, the letter A, which is down at the bottom of your diagram there, that's pointing at the septum. Okay, and the next letter B is pointing at the the right ventricle, and of course as we go up, we've got the atrioventricular valve, we've got the aorta, we have the inferior and superior vena cava. Okay, so if we're looking at the heart, hopefully we're seeing that. And then of course this structure here on your diagram, the pulmonary artery, is actually here on your picture, or excuse me, on your actual diagram. All right, sorry, I keep vanishing on you. All right, now the next thing is the if we kind of turn our diagram, we can start to see the pulmonary vein, which are represented by the letter M right here. Okay, and then we've got our left atrioventricular valve, and then of course our left atrium, and then we can barely kind of see it, but right here, that is the aortic semilunar valve, which is going to this large branching structure, which is the aorta. So we have the left ventricle, the aortic valve, and then we've got the actual aorta itself. Now, if we look at the pig heart with respect to this, we take a look, and we'll go ahead and zoom in a little bit more. We have the superior and inferior vena cava, right atrium, right ventricle. We have the coronary artery, which is not shown in the picture. We have the left atrium, left ventricle. We have the pulmonary artery, which is on top here. It's the most ventral blood vessel. Just dorsal to that is the aorta. And then, of course, back here we have the pulmonary artery. Excuse me, vein, pulmonary vein. Pulmonary vein is in the back. This is the pulmonary artery. That's the pulmonary vein. The artery goes away from the heart to the lungs. Pulmonary vein comes back to the heart from the lungs. All right. There's one other thing I want us to take a look at, and that is a circulation diagram, because we don't talk about that enough, I don't think. But I think this diagram does a good job of showing you a picture of it. Imagine that this is your heart, which it's obviously the pig's heart, right? The blood that is coming from the pulmonary artery is going to the lungs, and then it comes back to the pulmonary vein. That is what we refer to as pulmonary circulation. It's the circulation of carbon dioxide rich blood, or oxygen poor blood, to the lungs, and oxygen rich blood coming back to the heart from the lungs. That's pulmonary circulation. It's reoxygenating blood. Systemic circulation is all of this other stuff. That's cranial systemic circulation. This is caudal systemic circulation, so that we are taking that oxygen-rich blood, sending it to the body, and bringing that carbon dioxide-rich blood, or oxygen-poor blood, back. So let me rephrase that. Pulmonary circulation is the movement of oxygen-poor blood from the heart to the lungs, and the movement of oxygen-rich blood from the lungs to the heart. That's pulmonary circulation. Systemic circulation is the movement of oxygen-rich blood to wherever in the body, and the movement of that used blood, which is now deoxygenated, back to the heart. And then pulmonary circulation starts. So we really have two loops going at one time. Hence the circulatory, or circle system, right? Circulatory system. I hope this is clarified, particularly the fetal pig portion of the dissection, but also that it's given you a little perspective on a little bit of human biology. If you have any questions, you can always ask. You can email me. You can see me in class, whatever. But remember that, well, always get to the heart of the matter. I know, that was awful. I really need to stop. Let's stop now. Bye.